Hi, everybody, and good afternoon. I'm News 13's Amy Hoyt. We are live from our newsroom on Harrison Avenue, and today is the 13th, and you know what that means. It is Buddy Check Day. This is our public service where we remind you, women, ladies, to do your buddy check, to check for lumps in your breast on your own, and then, of course, if you feel anything or you're uncomfortable, to check with your doctor. Most months we bring you breast cancer survivors to share their stories with us, but we also try to provide resources and information when we do these interviews. So today is going to be one of those days. There's a new service at Ascension Sacred Heart Bay, the Old Bay Medical Center, but it is Ascension Sacred Heart Bay, and they now have a breast cancer nurse navigator, and we'd like to introduce you to her right now. Her name is Tanya Graybill, and welcome.
Thank you. Thank you for having me.
Now, when we talked earlier, you had told me you've been in the area about 2 years. So tell us a little bit personally about yourself.
We moved here 2 years ago. My husband's in the Coast Guard, so we've kind of traveled all over. Found ourselves in Panama City, and we're going to call Panama City home. So.
All right, very good. Well, thank you to him for serving, first of all.
Thank you.
Tell us a little bit about, you're an RN, first of all, correct?
Yes, ma'am. Mm-hmm.
Okay. And did you do other things before this position?
Oh, yes. With Ascension, I worked in the cath lab prior to this role, but before that, I've worked kind of in almost every area of nursing. I've done emergency room. I've worked, med-surg, pretty much wound care. I've done all kinds of different nursing.
You have a lot of experience.
Yes, ma'am.
All right. So now you're the nurse navigator at Ascension. Tell us what that means.
So I actually work in the diagnostic center, so where we do all of our mammograms, ultrasounds, and what happens once a woman gets a screening, they may need additional studies, and then that's when I come in and help coordinate the scheduling of those studies. Also, if a patient needs a biopsy, I schedule the biopsy, I take a medical history from the patient, and then I'm actually in on the biopsy procedures.
And what I've learned from speaking with breast cancer survivors, that of course it's a shock when you hear the words you've got cancer, that the breast cancer, the biopsy has come back positive. And so they come to you. How do you help them through that stressful period initially?
So my very first interaction with patients, I like to, when I'm gathering that history, I like to talk to them and kind of try to identify any barriers they might have, or try to alleviate any fears that they might have, or just make them understand that I'm there for them. If they were to get a diagnosis, I'm there to help them through that process, and I will help them through the entire process until treatment.
Okay, now you mentioned earlier that you're there for the biopsy?
Yes, I'm actually in the room. I assist the provider and the mammogram tech or the ultrasound tech during biopsies, because we do them both under ultrasound or mammogram.
All right, so now someone is diagnosed with breast cancer. We've been through the mammogram, the biopsy. Where do you go from here with them?
So after that, I coordinate with their primary care provider and help them get follow-up to a surgeon, an oncologist, or any other care they may need after that.
All right, and let's talk a little bit about surgery. It's not for every breast cancer patient, but it is seen a lot. What do we offer here?
Here with Ascension, we have our fellowship-trained, the only fellowship-trained breast oncology surgeon in Destin. But in September, we're going to have Dr. Moody coming on. She's also a fellowship-trained breast oncology surgeon, and we're so happy to be having her coming.
All right, so you're talking about Dr. Smith that we interviewed a couple of months ago.
Dr. Smith is the one in Destin, yes.
Okay.
Yeah.
So they bring quite a bit of experience with them. And so she's coming in the fall, and she'll stay at Bay?
Yes.
All right.
She'll be on the 6th floor. We're on the 4th floor. She's going to be on the 6th floor. So.
All right. And your office is just outside the main building, correct?
Yes.
You're on 6th Street?
Yes.
All right. So tell me what else. What else comes? I'm trying to think chronologically. If they need chemotherapy a lot, that happens before surgery.
Sometimes it depends. Sometimes it really just depends on the type of cancer a patient has, where it's at, the size of the lesion. Sometimes they try to get them into surgery as soon as possible. It really just varies patient to patient, cancer to cancer.
But you help get them to the chemo?
Help
treatment.
Get them lined up with a chemotherapist. We've got Dr. Johnson and Dr. Mann. And Lynn Haven, those are Ascension providers, but really any provider, we just try to get them connected with an oncologist.
Okay, same with radiation if they need it?
Radiation, yes, absolutely.
Okay, what else do you do? I know that you're probably just kind of getting your feet wet with the position because it's recently created.
Yes.
But what are you finding? Is there a common thread to what people ask you for?
I can tell when a patient comes and sits down and I'm starting to schedule them for a biopsy. I can tell, I can see the fear already. And so just with that alone, I'm reassuring patients that 70 to 80% of biopsies are actually negative. So that alone helps alleviate some fears, I think, and that's really the most thing that I've seen. It's that immediate fear. And then if people have questions, they can call me at any time, and I'm always happy to help them through anything. If I don't know the answer, I'll find the answer.
And the one thing that we also know is it's just not about the patient, it's about the entire family. Do you offer some kind of help there?
Absolutely. Patients are free to bring their family in to any consultation. I can go over the images, alleviate any fears they have as well. And then that also helps me get an idea, because sometimes patients don't always tell you everything, that they don't tell you. They got so much on their mind, and the family helps bring things to light too. So yes, I love to have family interaction as well.
So you're getting to know people
Oh,
on a
yes.
pretty personal basis, I would imagine.
Absolutely.
Does it help that you're an RN?
I think so.
Yeah.
I think so.
And
Over
you
the
have
years.
you're not a breast cancer patient, survivor, none of that, right?
No, but I think breast cancer has touched everyone. I've had family and friends diagnosed with breast cancer over the years. Yes.
So you've worked with people and you've been close to them. One thing we also talk about when we have survivors share their stories is how faith plays a role in their recovery. Do you offer any kind of services along the religious line? I hate to use that word, but
I mean, honestly, anything the patient needs, I could
you can
find
guide them.
resources, help guide them. Absolutely. Spirituality is very important in all aspects of healthcare. Yes.
What about finances? Even if you have medical coverage sometimes, you're still going to get a bill for something.
Right.
So how does that work? Can you guide them there?
There's national resources, there's community resources, there's resources for people who are underinsured. If patients need anything like that, there's always something out there.
Going back to the mammogram, we had talked earlier before we got started about mammograms, and not everyone has coverage. Can you get a mammogram somehow with a grant or someone else paying, or are there programs to help people who do not have medical insurance?
There is financial assistance that we can help patients file paperwork for within Ascension, but there's also assistance, like I said, nationally. There's programs out there. There's usually some qualifying factors that play into that, but there are so many financial resources for patients out there. Yes, absolutely.
What do you do if someone wants to go out of town? They start with you, but they say, listen, I'm getting the surgery somewhere else. There are cancer hospitals around the country that people use. Can you still guide them with that?
Absolutely. We've already had a patient come in that was actually, it was one of our first mammograms, and she had a mass and she needed a biopsy. But she was moving in 2 days. So she already had a lot on her plate with the move, but we were able to coordinate some care for where she was going and some follow-up, a biopsy actually, and we were able to print her images, print her reports, and send those off to that provider. So,
So you're there for everything, pretty
Yes.
much. It sounds like
Absolutely.
you're kind of like a one-stop shop.
Yes, absolutely.
What else do you offer? Is there something I'm not asking that people ask you about?
So the Women's Diagnostic Center, actually, not only do we do the mammograms, we do ultrasounds, and they don't have to just be breast ultrasounds. There's thyroid ultrasounds, pretty much any ultrasound needed for a patient we can do. Pelvic floor therapy is something we're offering there. Like I said, the biopsies, but also mag seed placement, which is pretty interesting. That's something a patient gets implanted into the mass, which helps surgeons on the day of surgery guide them to where that mass is to help them remove it. So that's kind of state of the art, because before they did a needle wire localization.
Ouch.
So this is pretty advanced
Much
technology
better.
that we have. Yes.
Yeah, technology's changed a lot, and that has helped, hasn't it?
Absolutely. I think so. Yes.
All right. What else? I know there's something else I'm not asking you. After treatment, maybe? Do you stay with the patient?
After treatment,
Or after they've recovered and they've, they're done with surgery and they've recovered?
so after recovery, even, I mean, they're going to need follow-up mammograms, and it depends on maybe what cancer they had or what their treatment ended up being. That might determine when they need their follow-up mammogram. So sometimes they need to be screened every 6 months. So we just make sure that they come back after that treatment for those 6-month interval studies or whatever else they need after treatment, yes.
Now, does your office or your department offer, is it just breast cancer, or do you do this for any kind of cancer patient?
Just breast cancer.
Yours is specifically for breast cancer?
Yes, ma'am.
And mostly women. We talked about that. Dr. Smith had talked about that because he had done a study on it a few years ago that, what is it, men are like 1% of breast cancer patients. Or
Right.
Right?
Yes, exactly.
So at this point, you haven't had a man come through.
We've had some male mammograms,
Oh.
but no positive for cancer yet.
Okay. What's the number one advice you have for women who may think that they need a checkup for whatever reason, or maybe they found a lump?
Oh, if they found a lump, absolutely, they need to come in. But even if they, a screening over 40 yearly, that's standard. That's something every woman should get. But even under the age of 40, if women have dense breasts, perhaps, or a family history, strong family history, you might want to talk with your provider about getting you in even before 40.
Okay. How do they contact you? Is that coming as a reference from their doctor?
Well, usually they've already come in, and then I come into contact with them that way, but anybody can call me at any time.
All right, so it starts right there. You got a phone number you want to give out?
Absolutely. 850-804-3909.
One more time.
850-804-3909.
Sometimes it's hard to remember phone numbers because we just hit a button on our phone, so you did really well. Good job. Okay. And we'll add the phone number to the website as well so that people won't have to memorize it.
Okay.
Well, Tanya Graybill, it was great to meet you. You provide quite an awesome service for women and men across the area, of course, to fight breast cancer. We appreciate you coming in. If anything comes up, anything new you want to let us know, we can add it to the website so folks will know about it.
Okay. Thank you for having me.
All right. Thanks for coming in. And that's it for now. We'll see you next time.